Hey everybody. So this is video 2 of 3 tonight. I actually had someone actually ask me a question for once out of all the videos that I've posted. And it was just the way that I hold the camera. I use my phone because the webcam on my computer is terrible. iPhones have much better cameras than some cameras. Um, I hold the phone because I have to use my hand, so that's one less hand that I can wave around and hit on stuff. Apparently, since I wear my ring all the time, sometimes I'll use it to emphasize my point, and I'll start banging on stuff, and all you hear is a bunch of clanging in my videos. So one of the reasons, and then I can move around. If I don't move around, I'll start to fidget, or move back and forth. I'll start to ramble, or I'll start touching my face a lot. So it lets me be mobile so I can actually focus more on what I want to talk about. Um, so like I said, this is video 2 of 3. Basically, being a better person. I think everybody should always strive to be a better person. Um, there's a quote I read recently. It's relatively old. I actually don't know who said it, to be honest. But your education ends when you leave school, but learning should be an ongoing process. So, I mean, whatever you want to get good at, whatever you want to learn more about, just get some books. Talk to some people who actually know what they're talking about. Um, Sometimes it has nothing to do with books. And sometimes it has nothing to do with education. Just being a better person can be being a better team player. For instance, my first nursing job, I worked in Louisiana at a hospital. I was on a particular floor during the days. Probably one of the worst jobs I have ever had in my life. And I used to go to old people's houses and sit with them till they died and cleaned them up, consoled the families. That was part of my job while I was in nursing. Excuse me. While I was in nursing school, um, they knew that I was going to be a nurse. They knew I had some medical background to me, I guess. They wanted me to take all the knocking on death's door patients. So I started to feel like the Grim Reaper. But, anyways, back to what I was talking about. First job was terrible. As a nurse, most of us get into it. More or less, it's a vocation. It's a calling. You want to help people. Um, it's not so much being codependent and needing people to need you. It's more about wanting to help people. It makes you feel good about yourself, obviously. But I wanted to help people, and being on that floor, never felt like you were helping anybody, um, except the hospital. You go in a patient's room, say, "Hi, my name's Corey. I'll try to take care of you today. Please don't turn blue. Here's a bunch of pills. I have to go see 5 other patients and make sure they're not blue either." So me and my wife decided that wasn't for us. Could not stand the place. So we moved to Texas. We moved here. I ended up working on a cardiac floor for a year or so and fell in love with nursing, honestly. The people I worked with were really nice, really helpful. Just because I was new, they didn't treat me poorly. Super, super helpful. Really, really smart people there. Um, I really felt more or less like a family. Everybody was helping everybody. They weren't going to just let you drown simply because they wanted to take it easy that night. Even the patients were better, honestly. It just seemed like they were nicer. You would tell them, "Hey, your blood pressure is high. I need to give you this medication to lower your blood pressure." And they're like, "Oh, thank you, nurse. I appreciate you not letting me stroke out for having a blood pressure that's 220 over 168. You didn't get that when we were in Louisiana. Like, well, I don't take that at home. Well, it's probably why your blood pressure's so high right now. We're trying to fix that, but some people just don't want your help. Um, then we traveled for a little while, little bitty hospital down in Killeen, Fort Hood area. Super nice people there. Then we came back and now work in a medical surgical ICU. And it's the same thing. Honestly, I think it's the hospital we work for. They hire decent people. Work in intensive care now where everybody's nice. You always have that one person, maybe two people that honestly you feel like don't fit there because they're not like the other people. They're passive aggressive, whine, like to gossip. Majority of the people though in the ICU are fantastic. They're constantly helping us out. I'm always learning. If my patient starts going south, I'm not there all by myself trying to make sure that they don't eventually expire. You've always got 3, 4, 5 people right behind you ready, always asking you, hey, what do you need me to do? Or, hey, I've seen this before, let me help you out. So ICU is already a stressful job, but having those people there and knowing that they're there for you makes all the difference in the world, and it makes it less stressful. You've got dying patients, so of course it's gonna be stressful, but it really takes a load off of you. So went off on a tangent, but being a better person could just be being a team player. When I have relatively stable patients that don't need a constant infusion of medications to keep them alive, I'll walk around our unit. I'll walk around ICU and ask, hey, is there something I can do for you? Or if I see somebody starting to struggle, hey, I know you're stuck in this room with this patient. Do you want me to check on your other patient? Are there any medicines I can give for you? Hey, this patient's really big. Let me help you turn this person. I mean, it's as simple as that. Just simply asking somebody, do you need my help? That's all I got. I mean, some people aren't programmed that way. And I mean, maybe you need to look inward for a second and think that maybe the world's not crap. Maybe you need to work on the stuff that's going on inside you first. Maybe it's not your coworkers that are terrible people. Maybe you should look inside and say, hey, am I the kind of coworker that I would want? And honestly, that might be it. Maybe you need to work on yourself a little bit. I know that for me, that's happened a few times where I've looked in and said, hey, this person, shouldn't be getting to me this much. Even if they are a passive aggressive person, maybe I just need to go out of my way to help them, to make them feel more at ease so they don't have to feel like they need to be passive aggressive for whatever reason. That's about it. Let me know what you think. Like I said, the videos are supposed to be a day-to-day thing, showing my progression towards April when I compete at the end of the month. But I like to throw in a little bit about me so you'll actually know who I am, what I'm about, the kind of person I am. Because people competing, people doing fitness, people giving out fitness and health advice are a dime a dozen. I'm pretty much plagiarizing the CEO of First Form, but six packs, big butts, all that kind of stuff, tan skin, they're everywhere. It's who you are as a person on the inside that really matters. And that's what people are going to see. That's what's going to attract people to you. And that's it. Let me know what you think. Subscribe, post, comment, ask me questions. Anything you can think of. If you think I shouldn't be posting in my kitchen anymore, or if I should be a more interesting person, let me know. Stay tuned. and I will see you all soon.